Hi, I'm Dr. Daniel Benrubi. I'm an assistant professor of gynecologic oncology here in the Department of OBGYN at UF Health Jacksonville. I chose the field of gynecologic oncology because I find it to be the most rewarding out of all of the specialties that I encountered in medical school. I consider there to be nothing more noble than taking care of women in the Northeast Florida community that are at a very vulnerable period of time in their lives where they've been diagnosed with a gynecologic cancer. And it's an honor and a privilege to help those women through their treatment, whether it be with surgery, chemotherapy, or other modalities, so that we can achieve the best outcomes and they can go on and live healthy, productive lives. There are several cancers that are unique to women that I treat. Endometrial cancer, which is a cancer of the inside lining of the uterus, as well as other uterine cancers. Cervical cancer, ovarian cancer, vulvar cancer, vaginal cancer, and gestational trophoblastic disease, which can happen at times after pregnancies. These cancers require specialist training in order to adequately treat and requires expertise from a gynecologic oncologist in order to have the best outcomes. There are screening tests for gynecologic cancers, specifically cervical cancer. The Pap smear or Pap test is the most proven screening test for cervical precancer and cancer and should be obtained at regular intervals in consultation with a patient's OBGYN or primary care provider. We don't currently have screening tests for endometrial cancer and ovarian cancer. However, there are symptoms to look out for, including postmenopausal bleeding for endometrial cancer and GI symptoms such as bloating, abdominal pain, and increasing abdominal girth for ovarian cancer. Here at UF Health, we have all of the subspecialties that we need to adequately treat your cancer. I regularly partner with my colleagues in radiation oncology, complex surgical oncology, medical oncology, pathology, colorectal surgery, and other specialties in order to optimize patient outcomes and deliver the highest standard of care. We routinely stay abreast of national guidelines for treatment, and we personalize those guidelines so that we develop an individual treatment plan to optimize the best outcomes for our patients.